The purpose of this video is to go through certain functional movement from the functional movement screening program as they pertain to Caitlin Nomick's capstone injury intervention and clinical intervention program for the class of 2021 at University of South Florida in the post-professional athletic training program. All the movements are seen in the capstone and goes over the scoring for each movement as well. First, we have the deep squat. The athlete will be instructed to hold a dowel rod overhead to where the elbows and shoulders are at a 90-90 position. Once that athlete is comfortable, they'll be asked to push the dowel rod above the head and then go into a squat. The squat is look at making sure that there's any forward movement. Then the athlete can do a modified deep squat, as you'll see next. The deep squat is modified by putting the 2x6 underneath the heels and then looking for any forward progression or forward bending of the body. The dowel rod should move in a vertical line. Next is the hurdle step. The hurdle step is used to look at multiple movements and stability of the hips and core. The athlete will be instructed to hold the dowel rod and rest it on their shoulders, and then the hurdle will be measured up to the point of their tibial tuberosity and set at that height. The athlete will then be asked to step over with one leg, landing their heel on the opposite side of the hurdle, and then returning that same foot back to the starting position. This exercise will be done twice. They have 3 full times to try it and complete it. Next is the inline lunge. The athlete will be asked to hold a dowel rod on their back. Their top hand will be placed at their neck, in the back of the neck. The lower hand will be placed at the back of in the middle of the lower back. Dowel rod is to show any lateral movement while performing the move. Then the athlete will be asked to step onto the 2x6 with their back toe on 0 and their front heel on the measurement of their tibial tuberosity. Then they will perform a lunge. We're looking for balance, motor control, or the inability to do the exercise. The next screening movement is the active straight leg raise. The athlete will be lying down on the ground next to the 2x6 that has the measurements or the ruler on it. The athlete will be instructed to keep one leg straight, and the involved leg, they will raise it up as far as they can go without bending their leg at the knee or compensating at the hip. The athlete will have 3 times to try this movement, and the best score will be scored. Once the athlete feels pain or cannot go any further, that is where the tester will measure the athlete's score. This shows flexibility, hip control, and relative hip strength as it pertains to moving the leg forward. As with the rest of them, they will be able to test 3 times. The final functional movement test that will be used for pre and post test is the rotary stability test. This is the hardest movement of the functional movement test. The athlete will be on all fours with the 2x6 between their knees and their hands. The first movement, the athlete will be instructed to take the same side hand and the same side knee and extend both of them and try to stay in a level position. This movement is also able to be modified, and most athletes will not be able to do it unless they have a crazy strong core. So you'll see here, I try to do the first one, but unable to control it. The next movement, I try it again, do okay, but I cannot bring my knee to my elbow. The next movement is I do opposite and bring it in, extend, and then back down. Thank you for watching this video, and if you will move back to the next slide, where the scoring criteria will be gone over on that slide. Thank you and have a great day.